Cali wants me to answer a couple of questions. Okay, so let's look at this. Okay, sorry. Okay, so I am currently working to come up with actionable solutions to a pressing global health issue, and the topic of this case is NCDs in Kenya, specifically around how community health organization in far western Kenya is able to better address the needs of people living with NCDs. Please note that people living with NCDs in the remote areas. Specifically, our challenge is to investigate why there is breakdown in trust between communities and the formal health system. So here I will answer why there is breakdown in trust between the communities and the formal health system, and how to overcome a tendency in under-resourced areas to address disease in silos rather than working a patient as a whole person that may experience multiple different health issues. She's also supposed to research on the Ministry of Health, what the Ministry of Health has done, Ministry of Health in Kenya has done to tackle these barriers, what its plans are, if there are any budgets around it, if there are any partnerships, and are they even thinking about this. And yeah, so thank you, Cali, for your very long and detailed message. And yes, I am the right person to contact. Let me give you an introduction about who I am. My name is Leah Kilenga. I am the founder and executive director of Africa Sickle Cell Organization, a non-profit that works to create healthcare systems. Well, rather, not create an organization that works to show the demand, show the need of healthcare systems by highlighting the gaps within the community on those healthcare systems by using different ways of advocacy to bridge the community with decision makers so that this bridge can be built and people can have access to medicines and can, be healthy here, especially focusing sickle cell. So my main work is not to work for the government, is not to do the work of the government, is to show the need, to create demand for these services within the community, and to also support the government with regards to policy and guidelines and how to implement that and how to make sure that all these people are catered for. Yeah, and I am a person living with an NCD, and that is sickle cell. And I recently moved from Nairobi to work mainly in the community, and I've been working in the community for about 1.5 years now. So based on the information and all the knowledge that I've worked with, I will be able to give you an answer. I've also worked with I work with the Global NCD Alliance as the Global Advisory Committee, at the Global Advisory Committee on the Our Views, Our Voices, which is an initiative to meaningfully involve voices of people living with NCDs around the world, to for governments to be able to create budgets for NCDs and prevent further disease burden in various countries, and translate all that down into specifically this country, where I am an NCD champion and a sickle cell champion that works very closely with CSOs and Ministry of Health to do the same, to advocate for the meaningful involvement of people living with NCDs. I hope my voice is not going, people living with NCDs, to be on the table with decision makers and making these policies and guidelines collaboratively, not designed for them and then they need to yeah. So yeah, basically that is what I do, but I work majorly from Taveta, so sometimes internet is a problem, sometimes electricity is a problem, but yeah. Anyway, first question: why is there no trust in the community informal health systems. So this you have to look at why would you not go to the hospital. So community deals with different levels of facilities. There's the primary healthcare facilities, then there's a secondary healthcare facility, and then there's a tertiary level healthcare facility, and then there's the referral healthcare facility. So if the systems are broken, if those systems do not communicate with each other, then there will not be a seamless flow of services. Okay, so what I have experience on the ground working with community organizations, working with community health workers, and also just people living with NCDs and just the general community, is that it's because of broken health systems. When you go to a facilities and they do not have medicines per se, if they don't have trained workers, health workforce, or workforce that is presently there to serve them, or if you go to a facility that you are mismanaged, you will not go back. Definitely you will not go back. So most of these facilities lack the resources to be able to run these facilities and provide quality services. There is no proper service delivery. That's why as a patient, when you go there and you're mismanaged, you're told, oh, you don't have medication because, I don't know, the county hasn't stocked them, and you're in serious need, then you will not go back. You will not believe them. You will not trust that system to cater for you. And with regards to the political leaders here, is that you can have a health system, a health facility, like a primary health facility that is a clinic or a dispensary that serves a specific community unit. But now these may be facilities funded by political leaders to get people to find favor in them. However, there is no education and empowerment and understanding for those particular community leaders that to have this facility there, you need to equip it with the services and the health workforce and the medicine, like the software. They are more inclined to fund the hardware, which is the physical thing that people can see, but the service is not really keen. They are not really keen on looking into it. You understand? So it's like a shell of a building with no medication, with no lab services, with no health workforce, and it's just there's no service you can get from there. So people end up going to herbalists or local doctors, traditional healers, because yeah, that's just the way it is. Yeah, so it's just, for me as a patient, speaking from my experience, why I do not have trust in formal health systems is that I do not trust them to care for me the way the private health system will. Because for sickle cell specifically, and for other non-communicable diseases, is that we have we need comprehensive care. It's a specialized kind of care that maybe the government facilities are not able to cater. So that is why I would choose to go to a private facility, because I can afford to. But those who cannot afford to have to go to formal health systems like this national hospitals or this government hospitals. And in most cases, not in all cases, in some cases you see a lot of mismanagement. You're in a long queue and you're in crisis and you're in pain. How can you go back there? How can you trust that system? If you hear one of we have experienced a couple of times some of the patients' blood being cross-matched wrongly, and the blood being transfused to the patient, especially for sickle cell, is wrong, and now that causes a lot of complications and even death. And there's also where there's a lot of capacity on the beds and there's no beds, so you're sleeping either on the floors or two people per bed, and it's not that you lose lack of trust, it's just that you're so it's like this is what you have to live with. Like there's like you don't have, like if you cannot afford it, if you have a low income, or if you're in poverty, then the health service, then you shouldn't get sick, because the healthcare system is not meant for you. Yeah, because it is oppressive for the poor. Yeah, because the services that you get is not the equated to the service of the private facility where some of us are privileged to go to. Yeah, but it's not that it is perfect, it's just that it is better, and NCDs have other comorbidities that also need to be treated. And yeah, it's that's it. Like there's a lot of reasons why people lose trust. It's personal, it's political, it's the services, it's the money. Yeah. The next one, I'm sorry, I hope I didn't go too long, I hope I didn't lose you, is how do you overcome treating patients as silos rather than treating them as a whole entity? Wow. We have to understand first that and like healthcare in Kenya has been devolved. It is no longer the mandate of the Ministry of Health, the National Ministry of Health. It has been devolved to the counties, where counties now allocate their own budgets. Counties then look at the needs on the community or the needs in their various counties, and then allocate budgets or programs or all that. Yeah. So what the Ministry of Health does is policies, guidelines, and just overall guidance of the system, but county is what does everything. So why are people still being treated in silos? Like, oh, you have a headache, come to this doctor. you have an like your ear is aching, go to this other doctor. Like it's like, you know, yeah, it's sad, because one of the biggest reasons that I have realized is that the funding is what dictates the management, basically. End of story, full stop, close the book, throw it away. Because we are used to the current systems are used to the funding, the funding of HIV, TB, malaria. Yeah. So they're used to that kind of old funding system where it's just money, and then you do with it whatever you want to do with it. Yeah. But now it's like they have to rethink and budget program based and project based and itemized funding. So you cannot use the kind of funding models we did use during HIV, TB, malaria, for HIV, TB, malaria, for non-communicable diseases, because non-communicable diseases are many, and they have their own specifications and specializations, and then their own characteristics. And some of those NCDs come with multiple comorbidities. Yeah, so you cannot fit that into this. It's just there's a disconnect. So that is why most of the communities or most of the counties are still having a big problem with regards to, yeah, because it's just they're still, you know, it's a hard transition because the funding is still kind of rigid. And also NCDs don't have funding. Rather, many don't have funding, unless it's the big five: the cardiovascular disease, cancers, diabetes, mental health, alcohol injuries, drug and substance abuse. The others really do not have to really compete for funding. So that is also another reason why you will find a patient who goes to the hospital with sickle cell will not be maybe treated for kidney disease, or like it's like you have to come again, or they'll have to put you under something else. Yeah, because it's just even the health systems, the health management information systems are the old kind of system, the HIV, TB, malaria kind of system, kind of model. So even the recording of these diseases in the facility level, you can't really know how many people live with, how many people are affected with NCDs, or how many people have diabetes, hypertension, cancer, sickle cell is put under general anemia. So like it's just, yeah, so you can't have that, and you can't have that, you cannot go and get data that this person lives with diabetes and hypertension and this other thing. You just have multiple listing and several, they appear several times, but it does not marry. So it's just the old system of thinking, and as well as counties still haven't really factored in NCDs as a problem. Yeah, and those who have focus on only specific NCDs, like the big NCDs like diabetes and hypertension and cancers, those ones. Yeah, and it's just a matter of making them aware, because currently in Kenya, and I think the world, more people are like 50% of people who are in the hospital, 50% plus of people who are in the hospital because of non-communicable diseases, not communicable diseases. And most of the deaths currently are because of non-communicable diseases. Yeah, but counties still don't have a person in charge for NCDs. Counties still don't have budgetary allocation for NCDs. Counties still don't understand the NCD burdens within their own places. Yeah, unless they're actively looking at that, unless it's an active problem. Like in Taita Taveta, there is a huge burden of diabetes and hypertension, and that is recorded, as well as HIV and TB and malaria. All those things are recorded, but you will not find where they have sickle cell or epilepsy or asthma or all those other illnesses that are non-communicable disease, because the funding is not there. The recording system is just doesn't marry. It's very old, and you can't even change, because you have to go to the national level to change that. And it's just how they've done it before, and they've done it ever since, and they depend on funding. And if donor is doing HIV, then that is all they will do. So we have to shift the way we are thinking as communities, as Kenyans, into how can we be able to truly change the way we use money for healthcare. How do we plan for healthcare? Is healthcare sustainable if it is siloed, or are we really going to move into the patient-centered kind of healthcare system? Because that is the, I feel, more ethical and more sustainable way. So lastly, she wanted to know what is the MOH doing? So the Ministry of Health in Kenya is there's so many gaps in non-communicable diseases, and it's just, especially now that the counties are devolved and the gaps are apparent, that the community is disconnected from their health system, because a lot of people are ending up going to the National Referral Hospital, Kenyatta Hospital, and it's becoming very overwhelmed and stretched, because down the line, the primary healthcare facilities, secondary, tertiary, referral, up to the National Referral Hospital are not coordinating and are not working together. So what is the Ministry of Health doing besides creating those guidelines, besides making those policies. The Ministry of Health has a division, and the Ministry of Health, the Division of Non-Communicable Diseases, that is focused specifically on the NCDs that are affecting Kenya. Yeah, that is the 5 major, including cardiovascular diseases, cancers, diabetes, hypertension, drug and drug abuse, injuries, mental health, and then there's things like sickle cell, and epilepsy and other conditions that were not focused, they were not given the specification or the focus that they needed, but now that they have, and they have different people on those particular diseases responsible. Okay. Anyway, so what is the Ministry of Health doing aside from the guidelines and having those people in place? So they work collaboratively with different partners to support this fragmented health systems. Like those partnership launched last year between World Bank and Access Accelerated, which is a consortium of biopharmaceuticals, that is Pfizer, Novartis, all those pharmaceuticals, and Ministry of Health and Amref, to launch an NCD program that integrates NCDs into primary healthcare. Yeah, to tackle the NCD crisis at the grassroots level. So I will link that link, yeah, those details for you so that you can read more about it. But they are working. They are piloted in 2-3 counties to be able to understand how can they integrate NCDs into primary health care. How can they cost NCDs in primary health care? How can we be able to understand the dynamics of NCDs at that level so that we can be able to expand that throughout Kenya? All right. And that one is being launched in a couple of counties. Amref is involved, and yeah, different kind of partners. Yeah, and I was there, Sitawa was there, and Sitawa also wrote an opinion piece about that meeting, which also included universal health coverage. So I will also link that below so that you can also read on that. The other thing is Ministry of Health is working very, very closely on the matter of NCDs with CSOs working around NCDs, specific NCDs and multiple NCDs, including myself, and also through the Non-Communicable Disease Alliance of Kenya, where all these NCDs partner organizations are under. So last year, there was 2017, there was an active initiative from the Global NCD Alliance. They launched an initiative called Our Views, Our Voices, yeah, which is the one that I was telling you about, which is generally meaningfully involving the voices of people living with NCDs all over the world, so that we can be able to be part of the conversation, so that we can be able to understand what is happening and how we can be able to move to create need and create demand and to call action to governments towards tackling NCD crisis across the globe. So they launched the advocacy agenda of people living with NCDs that highlights all that, which I will link below. And in Kenya this year, early this year, we launched the advocacy agenda for people living with NCDs in Kenya, and what we want to be done by the government, what services, and what our asks generally for the service. So putting people living with NCDs at the table is one way of understanding the user, understanding the beneficiary, yeah, understanding the actor that your particular services are targeting. And people living with with NCDs like myself are actually experts at our own rights, because we see those gaps, because we experience these gaps as we go through these systems. How can we sorry about this how can we be collaborative in terms of our awareness and our experience be used as research, as evidence, to be able to fill those gaps that exist in health systems. Yeah, me being in the community level has just opened my mind and I don't know if I will work at the national level, but this is just like, there's so many things that need to be done here, and those are the kind of voices they need. That's why I'm at the Global Advisory Committee for this particular initiative. Yeah, so I will link all that here. And then they're also working with Amref. Amref Health Africa is a non-profit that works mainly with community health workers, either through training and understanding of particular ailments, just sharing information to the community, linking patients with primary healthcare facilities or referral facilities. And they're actually piloting the universal health coverage this year, and no, last year. And this is basically how can you be able to financially protect communities by enrolling them into the NHIF initiative insurance. Yeah, and they're using community health workers. So how can, aside from universal health coverage, how can NCDs be allocated for within universal health coverage? How can all these things can be allocated at medicines, services, yeah, all these NCDs with their multi-comorbidities being included in universal health coverage? And yeah, so this year there's the UN high-level meeting of UHC, and the CEO of Amref Health Africa in Kenya is on the chair of the UHC committee, and we hope that we are going to improve that in Kenya. So they actually started in 4 counties. They piloted in 4 counties: Kisumu, Nyeri, and 2 more that I cannot particularly remember, which they will also roll it out to the other countries, because one of the big 4 agendas of the presidents is provision of universal health coverage. Yeah, I think it was universal health coverage, yes, which also makes the partners, people involved with NCDs, how can we be able to get NCDs there in universal health coverage? Because we know, like, some NCDs are not covered in normal health insurance. We're not given health insurance, like sickle cell. We are majority of the payments are out of pocket if you're not covered under your parents, or if you get an insurance company that will cover fully. You're lucky, but it's something that is rare and that will cover you like properly. So yeah, so how can we be able to reduce the cost? Because we know sometimes NCDs is a result of poverty and results in poverty. So how can we shelter, how can we ensure, how can we protect communities using that, and especially communities with the burden of NCDs? Yeah, I'm sure there are a couple of other things the government is doing, because the government, that division particularly, does a lot of work around NCDs, and those are just ones that I needed to highlight because of the various things happening around the world. Last year there was one high-level meeting of NCDs. Our president was one of the speakers and urged other leaders to come together with regards to tackling the NCD crisis. So it's it's a work in progress. NCDs are lifelong chronic illness and just multifaceted, multi-pronged, multi-everything, and just financially needy. They're very financially intensive, and yeah, that's why, yeah, we can see all these gaps. So I really hope that all this information has helped you. If it hasn't, I really hope whoever is watching is helping you one way or another figure out one or two things. But I'm really grateful for your question. If there is anything else that you want me to answer with regards to health systems, to NCDs, just let me know. Okay, I will you all the best, my dear.